Vitamin B6 is known to enhance alertness, cognition, energy, elevate mood, lower anxiety, and normalize homocysteine levels. Vitamin B6 is one of the 8 B vitamins. B6 is water-soluble and is found in every single cell in your body. It's a required coenzyme for the synthesis of dopamine, epinephrine, GABA, melatonin, norepinephrine, and serotonin. For the brain, B6 is crucial for the synthesis of these neurotransmitters. Even a mild deficiency results in downregulation of GABA and serotonin synthesis, leading to poor sleep, behavior problems, cardiovascular function, and the loss of the hypothalamus pituitary control of hormone secretion. B6 was first isolated in the 30s. The 6 in the vitamin refers to the 6 common forms, namely pyridoxal, pyridoxine, pyridoxamine, and the phosphorylated forms. Pyridoxal phosphate is the active form of the vitamin B6, and is said to be the most versatile organic cofactor in the body. More than 140 distinct enzymatic activities in your body and your brain depend on the PLP. The biochemical reactions in your body by the PLP-dependent enzymes include the making of hemoglobin, amino acid synthesis, and fatty acid metabolism. It also functions as a coenzyme that catalyzes the release of glucose from stored glycogen, turning it into the type of energy that your brain cells can use for fuel. For cerebral circulation, B6 is needed to regulate homocysteine. High homocysteine levels are linked to inflammation, and this can lead to blood vessel damage and possibly plaque buildup leading to heart attack or even a stroke. B6 is a cofactor in the synthesis of neurotransmitters dopamine, epinephrine, GABA, norepinephrine, and serotonin, so it affects alertness, cognition, memory, and mood. B6 helps to increase the brain's serotonin and dopamine levels, decreasing anxiety, depression, fatigue, and pain. B6 is found in every cell in your body and your brain. It's a necessary cofactor in the folate cycle, and it contributes to the synthesis of neurotransmitters dopamine, GABA, melatonin, norepinephrine, and serotonin. B6 has a direct effect on your immune system, gene transcription and expression, and it's involved in glucose regulation. B6 protects your blood-brain barrier by regulating homocysteine levels. Excess homocysteine can damage blood vessel linings and neurons, resulting in cognitive decline. B6 also helps to form myelin, the fatty sheet that surrounds and protects the neurons. Pyridoxal phosphate, the active form of B6, helps to control inflammation in your brain. Low levels of the PLP is associated with severe inflammation in the brain, leading to neurodegenerative diseases like Alzheimer's and Parkinson's, and it contributes to heart disease, arthritis, inflammatory bowel disease, and diabetes. Foods rich in B6 include bananas, beef, chickpeas, pistachio, pork, potatoes, and turkey. Even mild B6 deficiency can deplete neurotransmitters, and this can lead to cognitive decline, resulting in brain fog, anxiety, depression, and overall poor mental performance. B6 and its role in the amino acid metabolism make it a crucial component for the synthesis of all major neurotransmitters, including dopamine, GABA, melatonin, norepinephrine, and serotonin. The synthesis of these neurotransmitters is entirely dependent on B6 levels in your brain. Even mild deficiency results in less GABA and serotonin synthesis, resulting in poor sleep patterns, irritability, anxiety, depression, panic attacks, and stress. Low dopamine levels and norepinephrine due to a lack of B6 can lead to depression and loss of memory. B6 plays a crucial role in optimized cognition, and should be part of everybody's dietary intake. Unfortunately, there's very little talk in the nootropic community about this nutrient. A review of vitamin intake in Germany, the UK, the Netherlands, and the US was conducted to compare vitamin intake to the national recommendations. The study found intake was below the recommendations of even the most critical of vitamins, including the B vitamins. The authors of the study noted that this gap exists in vitamin intake and national recommendations for a significant portion of the population, even though diverse food was available. B6 helps to reduce inflammation. B6, along with B12 and folate, help to control homocysteine. High levels of homocysteine have been implicated in inflammation, leading to the damage of blood vessels, causing heart and neurodegenerative diseases. But homocysteine is not the bad guy when it's in balance. We need this amino acid for the synthesis of cysteine, which is a precursor to the master antioxidant glutathione. It's when homocysteine gets out of control that it causes the problems in your brain and your cardiovascular system. One of the issues with aging is brain shrinkage. Grey matter shrinkage in key areas of the brain has been identified in Alzheimer's disease. Professor David Smith at Oxford University in England conducted a study with 156 elderly patients who were over the age of 70 and who were suffering from mild memory loss and higher than average levels of homocysteine. High levels of homocysteine are typically the result of deficiencies in B6, B12 and folic acid. For 2 years, the elderly patients received 20 milligrams of B6, 0.5 milligrams of B12 and 0.8 milligrams of folic acid. The findings of the study were dramatic. Those who took only the placebo experienced brain atrophy of 5.6% over the 2 years. Brain shrinkage in those who took the B vitamins had only 0.6%. This study showed a 7-fold difference in grey matter shrinkage in just 2 years. B6 along with B12 and folic acid helped to protect the brain density, and specifically in the areas of the brain vulnerable to Alzheimer's. B6 deficiency is a lot more common than you'd expect in your modern society. B6 from diet alone, especially for vegetarians and the aged, is not adequate to supply what the body and the brain needs. Concentration, memory, learning, and recall all decline. Anxiety, confusion, irritability, and depression all increase. Homocysteine and inflammation increases. Energy levels decline. B6 is critical for nerve function, and a deficiency can result in psychiatric disorders, seizures, migraines, chronic pain, and mood disorders like depression. B6 is involved in the regulation of cognitive function and mood. B6 is a cofactor in the neurotransmitter directly related to alertness, anxiety, attention, concentration, memory, and mood. B6 improves concentration and focus. When you add phenylalanine to your diet to boost the neurotransmitter dopamine, epinephrine, norepinephrine, and melatonin, it will not work without B6. B6 is a critical cofactor in the synthesis of these neurotransmitters. The same holds true for any nootropic that you use with the intention of boosting any of the major neurotransmitters in your brain. B6 is absolutely required if you want them to do their job. You need B6 to help to control inflammation in your brain. B6 suppresses the inflammatory cytokine interleukin-6 and tumor necrosis factor alpha, or TNF-alpha. B6 is essential for controlling elevated homocysteine levels, which can damage the blood vessels crucial for the optimal cerebral circulation. A 2008 review of research in the previous 10 years, covering a total of 77 studies and 34,000 subjects, demonstrated the relationship between cognitive deficits and dementia and the status of folate or B12 and B6 and homocysteine levels. B6 is the coenzyme involved in the synthesis of heme, an iron-containing component of hemoglobin. Hemoglobin is found in red blood cells and is critical for their ability to transport oxygen throughout your body and your brain. B6 concentrations in your brain are about 100 times higher than the levels in your blood. B6 is critical to the highly optimized brain. B6 is water soluble and has been shown to improve energy and mood. Both men and women report a boost in libido when they're supplementing with B6. Women report that B6 helps to control mood swings resulting from PMS. Neurohackers report that B6 helps sleep and to create vivid dreams. Many prefer it over melatonin for sleep. Those suffering with carpal tunnel syndrome have consistently found relief in symptoms by using B6. Many find B6 useful for tendinitis and other joint pain. Some report that supplementing with B6 helps to prevent sunburn, and a few have found relief from tinnitus. Those dealing with ADHD have found using B6 has helped to reduce the reliance on ADHD medicines, likely because B6 is a cofactor in the synthesis of dopamine and norepinephrine. 12 college students participated in a double-blind, placebo-controlled trial to examine the various claims that B6 increases dream vividness and the ability to recall dreams. The students were given 100 or 250 milligrams of B6 or placebo prior to bedtime for 5 consecutive days. Morning reports indicated a significant difference in dream salience scores. This is a composite score measuring dream vividness, bizarreness, emotionality, and color. The study suggests that B6 may act by increasing arousal during rapid eye movement sleep. The researchers hypothesized it had something to do with the conversion of tryptophan to serotonin. A study out of the Netherlands suggests that B6 could cut the risk of Parkinson's disease in half. Researchers in Rotterdam recruited 5,289 people over the age of 55, and it assessed their dietary intake using food questionnaires. The study looked into reports that increased levels of the amino acid homocysteine might promote Parkinson's disease. Numerous studies have reported that higher intakes of folate, B12, and B6 decrease the homocysteine levels and could offer protection from Parkinson's. It's been proposed that B6 could provide antioxidant effects and could reduce the risk factor for Parkinson's by a mechanism that's not related to homocysteine also. After 9 years of follow-up, 72 new cases of Parkinson's disease had been diagnosed. The average B6 intake was 1.6 milligrams per day. An average B12 intake was 5.3 micrograms per day, and the average folate intake was 218 micrograms per day. No significant reductions in the risk of Parkinson's were found for folate or B12, but when the researchers limited their calculations to the 66% of participants who were smokers, they found that the protective effects of high B6 intake appeared limited to this group. The researchers noted that several studies indicate the protective effects of nicotine on brain cells and on reducing the risk of Parkinson's. This suggests that B6 plus nicotine provides mutually reinforcing beneficial effects. Since folate and B12 showed no relationship to reduce Parkinson's, the researchers concluded it was not homocysteine that was behind the newly diagnosed patients. The study authors said the apparent benefits of B6 may point towards an alternative mechanism because several lines of evidence suggest neuroprotective properties of B6 through antioxidant capacities. Oxidative stress has been shown to be prominent in Parkinson's disease, and higher B6 intake may reduce Parkinson's risk through its antioxidant effects. Reduced serotonin levels are known as one of the causes of panic attacks and hyperventilation. Serotonin is synthesized from tryptophan, and for the synthesis of serotonin you need B6 and iron. To clarify how it works, the researchers at Atago Hospital in Japan checked the blood levels of vitamin B2, B6, B12 and iron from patients who came into the ER with a panic attack or hyperventilation. The team measured parameters in 21 patients compared to 20 healthy volunteers. The study found that both B6 and iron levels were significantly lower in the panic and the hyperventilation attack people than in healthy volunteers. There was no significant differences in B12 or B2. The study concluded that low concentrations of B6 and iron were involved in panic and hyperventilation attacks. Recommended dose of the P5P form of B6 is up to 100 mg per day. P5P is the only active form of B6 available and is preferred for nootropic use. The enzyme L-dopa decarboxylase depends on P5P to convert L-dopa into dopamine, and it's involved in the final stages of serotonin synthesis. An analysis of data collected in the US from 2003 to 2004 indicated that a B6 intake from food averaged about 1.9 milligrams per day. The problem is some forms of B6 from plants are not very bioavailable. In most cases, and certainly that of neurohackers using nootropics to boost neurotransmitters to improve mood, B6 from the diet alone is not enough. The study mentioned above shows that even those who were supplementing with 2 milligrams per day of B6 or less had blood levels of B6 that were too low. B6 is water soluble and you excrete it in urine, so daily supplementation is critical. Women taking birth control pills or who are menstruating are usually low in B6. Those following a strict vegetarian diet are typically deficient in B6. Drugs like L-dopa, anti-tuberculosis medications, metal chelators, metal xanthines to treat respiratory conditions, and long-term use of non-steroidal anti-inflammatory drugs, anticonvulsants, and phenobarbital all inhibit the B6 metabolism. If you're using any of these drugs, you're likely low in B6. You can safely dose up to 100 milligrams per day of B6 with no toxic effects. B6 is non-toxic at recommended doses, so it's considered well tolerated and safe. Side effects are rare, but very high single doses can include stomach upset, nausea, and diarrhea. Pyridoxine neuropathy is a form of nerve damage caused by high dose of B6 when taken for extended periods. Symptoms are the loss of coordination, extreme skin sensitivity, bone pain, muscle weakness, and numbness. Pyridoxine neuropathy has been reported in doses of B6 of 200 milligrams to 5,000 milligrams per day for extended periods of time. When the dosing was stopped, the symptoms usually disappeared. This nerve damage has been identified as the destruction of axons and neurons, which is reversible at lower levels of toxicity and irreversible at higher levels of toxicity. B6 is especially helpful for those suffering from low energy levels, anxiety, depression, and chronic pain. Experience shows B6 helps to stop and reverse the symptoms associated with high homocysteine levels. B6 in combination with folic acid and B12 will lower high homocysteine that's implicated in heart disease and Alzheimer's. B6 is also particularly helpful to students and executives who want to boost cognition, learning, memory, and mood, because it raises dopamine, GABA, norepinephrine, epinephrine, and serotonin in your brain. B6 can help those dealing with ADHD because it helps to synthesize dopamine and serotonin in your brain. ADHD symptoms should decline, and you may be able to cut back on your ADHD medication. B6 is a must-have addition to any nootropic stack. If you're using any nootropics to raise dopamine, GABA, or serotonin levels, you absolutely need extra B6. At the very minimum, every neurohacker should be using a multivitamin every day that includes a high-quality B vitamin.